Hello, everyone. My name is Dr. Ngozi Onuoha. I'm a physician and I'm the founder of Health for Naija. Today, I'm going to talk about how to empower your health. What I have to say is this video is just for the purpose of education, and it is not medical advice. So let's dive in. So as we know, health can be different sections. It can be your physical health, your mental health, your spiritual health. Today, I'm going to talk about physical health. Physical health is not a static condition. It changes and evolves. Every year, we get older and there are some things that change. For instance, last year, you may not have been diagnosed with diabetes, but this year you've been told you have diabetes. So last year, you may not have had issues with your blood pressure, but this year you're having issues with your blood pressure, and on and on. It could also be that your health got better or it stayed the same. So we know health keeps changing. So when it comes to physical health, you have to understand your own pushback mechanism as a person. So what is blocking you from attaining good or better health? If you feel you want to have better health, or you feel you need to make some changes about your health, what is blocking you from attaining that health goal? When you identify those barriers, you will then come up with your own solutions. So I will give you an example. For instance, if you have a fear of going to the doctor's office, or it's not convenient, you don't like going to the doctor's office. So how about you think about options that are available now, which include telehealth? So from the comfort of your home, or on the go, you can access your cell phone or a laptop, or if you're home, a desktop or a tablet PC, and you can dial in and speak to a doctor. So this is something that's easily available. And if you're the kind of person who is afraid of going to the doctors, these services are now readily available all over the internet. Even your local pharmacy may have a telemedicine option. Your doctor's office will have that, as well as the hospital. So that is a solution to this fear or lack of convenience of going to the doctor. So that is one way to tackle that barrier. So let's tackle another barrier that some people may have. So some people are afraid of their illness. They may not know what that illness entails. For instance, if a person has been diagnosed with high blood pressure and they don't like taking medications, so the question to ask yourself, if you have that fear of medication, is what is the benefit of this medication? If I take this medication, what benefit will I gain? And if I don't take this medication, what is the downfall of not taking this medication? So you have to look at the benefits and the disadvantages of not taking that medication. Let's look at somebody, for instance, who has high blood pressure. During this pandemic, a lot of people have gained weight and blood pressures have gone up. And so there are people coming up with diagnosis of hypertension who didn't have hypertension before, or there are people who had high blood pressure or hypertension who now their hypertension is worse. And there are people who just don't want to take the medicines for various reasons. So some people don't like taking pills, and some people are afraid of taking medications. So when you look at what blood pressure does, elevated blood pressure causes cardiovascular risk. And currently in America, we know that heart disease is the #1 cause of death. So something like an elevated blood pressure, if it means taking medicine to control it, Maybe you forget to take your medicines. What can you do? Very simple solutions in this day and age. You can set your phone alarm. If you're digitally plugged, you can ask Alexa to remind you to take your blood pressure medications. So you have to look at the benefits of taking the medications versus the disadvantages of not taking the medications. And that's a discussion to have with your medical provider. Now, if you have a chronic condition, be it diabetes, high blood pressure, asthma, or chronic pain, then you'll find yourself attending your doctor's office about 2 or 3 times a year. This is pretty standard because your doctor or healthcare provider is monitoring these conditions, monitoring the medications, making sure the dose is adequate, and also checking your blood for various blood parameters to make sure everything is okay. So here I'm talking about how to empower your health, and I'm giving you pointers. This is purely for education reasons and is not medical advice. So let's say there is a health problem. The question to ask the doctor or the healthcare provider taking care of you is, how serious is this condition? Is the condition stable or is it unstable? So unstable means, does it need immediate intervention, or is it stable enough where the condition can wait? So these are questions to ask your provider, and these questions will help your mind understand what is going on and help you get into action. So how do you engage with health systems? If you get seriously ill, do you know what hospital to go to? Is the hospital close to you? This is something we don't think about, but we should. We should have an idea of the hospitals and the health facilities around us. I call this contingency planning for our health. So we really need to have this contingency planning in place. It makes us better advocates, and we can really empower our health this way. Okay, so finally, before I log off, I'm going to invite the ladies to take a look at the checklist that is on healthfornaija.com/wellness. On here, you will find a checklist that basically will tell you what tests you need to do at what age. And these are routine screening tests. So I'll give you an example. For instance, the pap smear for cervical cancer screening starts at age 21. The mammogram for breast cancer screening starts at age 40. And the colonoscopy for colon cancer screening starts between the ages of 45 and 50. And for men, PSA, which is the prostate cancer screening, starts at age 50. So soon I'm going to have the Wellman's checklist on that website. So check back to see if it's up. So, and running. So thank you so much for listening. I really appreciate your time today. You can visit healthfornaija.com, on Instagram, on YouTube, Health for Naija, on podcast, anywhere you listen to your podcasts. And I wish you a wonderful day. Bye for now.